occipital tuberance here. We have your C1 vertebra, inner space, C1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7. Traditionally, the seventh spinous process is the largest. So what I'm going to do is I'm going to scan his cervical spine starting at C1 with the infrared thermometer. And we want to confirm that the area of greatest inflammation is that C6-7 area. And you can see that we have a spike in temperature right at about C6-7. So I'll repeat that there. We start upper cervical. He's pretty consistent in the mid-cervicals at 84.2, 83.9, 84.9. So you can see that spike, 85.1, right at C6-7, confirming that those osteophytic spurs are causing inflammation in that C6-7 joint in the cervical spine. All right. Now I like to hit the musculature and acupuncture. They call it one Chun lateral to the spine. It's going to hit those bladder meridian points. And then I'm going to check the areas of inflammation down his trapezius muscle, where the C6-7 nerve travels and eventually goes down the arm. Normally, the trigger points will tell where the pain pathway is worse. This tender right here, is that one of the points you get a lot right here, Doc? Is that tender? Okay.
Yeah.
Alright, so we got a spot right here. And we'll go down here.
The polysite, which one is going IV? Polysite?
Nope, 2 core site. So we want 1 poly and 1 core for the cervical spine.
Okay.
And 2 core for the IV.
Oh, so I need an extra core then.
So we'll start with the cervical spine. We can get the other core later. Hey Jim, we need 1 more core for the doc's IV. So that's how we mark the areas of greatest inflammation. So it's under laser guided, so it's laser accurate. And we're going to put the doc prone on this traction table. So you're going to get your glasses here. And you're going to lie with your face in the paper here. Okay, and you're going to put your hands right here, Doc.
Yeah.
You comfy?
Yeah.
Good. So the reason why I like to use this table is you can actually decompress his cervical spine. You feel that stretch in your whole spine? Yeah, so what that's doing is we're going to cause some decompression of the between C6, C7, and that will create a space. So when we graft the cells around C6, 7, it'll be easier for the cells to go into that space. Okay.
I'm all ready.
All right, so we'll go ahead and perform the procedure. This is the cryo spray we use. We don't like to use lidocaine, and this will anesthetize the area. So what we're going to do is we're going to put it,
We have an extra spot.
I'm going to retarget it, yeah, because there's a couple. We're going to ignore the center. This just gave me a reference point that this is a C6-7 spinous process.
Okay.
We're going to go right here. Where's the greatest inflammation? Yep, that was a good spot right here. And you're just going to go perpendicular, this angle, just like that. Yeah. And then we're going to put some right there. So yeah, I'm gonna have you put
1, 2, and 3.
1/3 here, 1/3 here, and 1/3 here. Let's go for this one first. Okay, so that'll give some local anesthesia for making the needle go in with less pain.
Little pinch.
Let's put 1/3 in there. How many fluid do you have total?
3 mLs.
Okay. Let's put enough where you only have 0.25 less for this, because I want the majority to go around the vertebra. Does that make sense? Doing good, Doc? Doing okay?
It's fine.
Good.
I'm fine.
All
I'm
right.
doing fine.
Good. Okay, so I want you to put, so as you can see, because we use the laser guidance, we avoided any type of blood vessels. There's no blood right there. And we're just going to put a Band-Aid on there. Now, because the majority of the degeneration is on this side, you're going to put all the fluid and just keep 0.25 for that trigger point right there.
Okay.
Okay. Yep, we're going to go ahead and use a cryo spray. Local anesthetic. Yep, perfect angle.
Little pinch. I can tell this is greater inflammation.
Yeah, a little more resistance. Yeah. But that needle went in perfectly.
You're okay, Dr. Lindero?
I'm fine.
I'm fine, okay.
Hey, Lauren,
I'm okay. I'm okay.
can we get some Graston tools? Can you wipe off some Graston tools and bring some wax?
Sure.
Okay, to get a Band-Aid for ready?
They're open.
Okay.
They're already ready.
Yep, there's open right there. You've got 0.25 left for that trigger point. Look perfect. Look, no blood. And put it right there, and the X marks the spot.
All right. All
I
new.
love the Italian
I
flag.
love this shirt.
Yeah.
I want it. You're just gonna have
Yeah,
to
no,
leave
we're going to
that.
put the remaining
I'll
cells
give 'em
into
a
this
piece
trigger
of
point
color
because
and-
we want to make sure we cover the path
I
of
love
the radiculopathy to regenerate that nerve pathway. And you're just gonna go, yep, pretty much perpendicular in that spot.
Little pinch.
Now this one you're only gonna go 1/4 of an inch, because this is actually the part of the trapezius muscle where if you go deep, that's actually the apex of the lung, so we want to stay superficial.
Okay.
Well, that's it. All right, and that's how we do the regenerative procedure for the degeneration of the cervical spine for C6-7. And what we're going to do to finish off is I'm actually going to do some myofascial release therapy. And we like to use these modified myofascial release tools called Laserguided. So I designed them to work in conjunction with the lightening diodes. So here's the purpose is we want to spread around
I'm making
some of the fluid so it doesn't cause any pressure in those local areas. But we want to keep around the C6-7 cervical spine. And this is going to make it more comfortable for the patient. The real purpose of doing this therapy is we're going to create some local inflammation because the cells will be attracted to the cytokines caused by the temporary inflammation. In this case, inflammation is a good thing because that's what activates the stem cells, creates a homing signal. You can see the skin is already getting a little red, and we want to attract the cells and have them stay in the lower cervical spine and this left peripheral nerve lesion pathway. And it probably feels pretty good too, doesn't it?
Yeah.
So this technique here, what I'm doing is I'm actually decompressing that C6-7 nerve, and this will help get the cells in there. And after that, we stimulate those cells with the light stim panel. And put 30 minutes there to finish off. And what this is going to do is bioactivate those cells to make sure they stay in the target tissue, which is the lower cervical spine. I'm just going to fold this shirt so it goes through the skin better. And we'll have that sit there for about 30 minutes. And that's how we do the laser-guided umbilical cord Wharton's jelly stem cell therapy for degeneration of the cervical spine with radiculopathy. All right, and thank you for watching.